I had a patient that had been to probably 3 or 4 different dermatologists and primary care doctor, and she just has been scratching and itching her skin. So everyone would diagnose her as eczema. She came in, she had excoriated her skin to where she was bleeding everywhere. An older lady in her 60s. And so she had some workup. She had a biopsy done from a previous dermatologist. And it's all pretty standard, the protocol you would do with someone itching. And then she just got frustrated because she didn't get better with the cream they gave her. So patients will do this. They'll doctor hop. Well, they go to one doctor. Either we tell them something they don't want to hear, and they go somewhere else, or they'll go once, they don't get better, they get frustrated, they go to another doctor, they go once, they don't get better, and they go to another doctor. Well, this patient came to me, and she'd already been to several doctors, and I said, all right, well, so you've already had a biopsy, let's get a copy of the pathology. Have you had blood work, etc.? No, I haven't done that yet. They talked about that, but I didn't like the doctor, and I wasn't getting better, so I came to you. My neighbor comes to you. I mean, usually it's some story like that. And this lady was itching profusely, and so the standard protocol would be, so often we'll biopsy, and there's some different things you would do with the biopsies. You might consider doing a couple different biopsies, one possibly for immunofluorescence, where we're looking for some immunologic disorders, some underlying blistering diseases, or autoimmune-based disorders. You're looking for secondary infections in their skin, so we will culture their skin, and then you're looking for internal issues with, often we'll do it with blood tests, so you're looking for kidney, liver, white blood cell counts, etc., something that's abnormal, like thyroid dysfunction, something that maybe hasn't been diagnosed in the patient. Well, in this lady's instance, she had a humongous mediastinum, which essentially she had mantle cell lymphoma, undiagnosed. And so she had been itching because of her lymphoma. And so we got the abnormality on the chest x-ray, which then was the next step was to get a CT scan. We order the CT scan, get her back to her primary care doctor. They get her to oncology. She undergoes treatment. Her itching goes away because her primary cause of the itching was malignancy or cancer. Very treatable cancer. Lady lived. Happy story. And that's where medical dermatology has a pretty significant importance in the medical community, where things like that get missed over because a lot of people don't think like dermatologists do because they just weren't trained that way, and that's not abnormal.